Since I'm paying for the mics, I'll take the first question and direct it to Steve, and then maybe after Steve gives his answer, we'll see if Peter has some thoughts on it too. But I mean, we've gotten several questions here, and one of them that I'm not sure. I mean, it doesn't relate directly to the data in the study, but it might explain some of it. Steve, you had said that perhaps part of it is just a preference for denser living, as it were, because of housing patterns and what have you in the sending countries. But is there an aspect here of especially more recent immigrants simply choosing to spend their money in different ways? And what I mean by that is choosing to send money home to grandma rather than spending it on, say, somewhat higher rent to get, an apartment that has an extra room in it or something like that. You see what I mean, Steve?
Yeah, and we do mention that in the report. As I indicated, about $68 billion, the latest World Bank figures, come from the United States in the form of what's typically referred to as remittances. And those remittances typically, as far as we can tell from the best research, come from immigrants. 90% plus do. So it's mostly immigrants who send money home. Some native-born people send money out of the country as well, but it's overwhelmingly done by immigrants, and that strongly suggests that might be a motive to save money on housing, or perhaps there are other things. Maybe immigrants would prefer to invest money in their children's education and so save money on housing in a way that native-born people don't, and perhaps there are other items that they would rather have. So again, it must be emphasized that that low-income immigrants, we also have a whole analysis where we look at people in poverty or people who live near poverty. And since immigrants are more likely to fall into those categories, and those categories are more likely to be overcrowded, that likely does have an impact as well. But what Mark's really asking is, why do immigrants who are nowhere near poverty, immigrants who make, say, $35 an hour or more, why are they about as likely to live in overcrowded housing as natives who make about $15 an hour? That isn't so easy to explain, and I think it has something to do with these things we've been talking about, a different perspective on houses, different ideas and attitudes, and so which make perfect sense, I think, and also this idea of maybe sending money home or maybe spending money on other things as well, and that I think likely explains or contributes to it as well. So I think there are a lot of factors there, and this data isn't very good at getting at that, but certainly that's another area to consider in the future for more research.
I was going to ask Steve another question here, and this kind of relates to the issue of housing as well. But is there a role? Your data doesn't obviously get this. It's just simply numbers collected by the government surveys. But is there potentially a role in zoning and that kind of enforcement, but housing occupancy rules in reducing crowding among anybody? I mean, immigrants or the native-born. In other words, because there are rules on this, different communities you can only have X number of unrelated people living together in the same home, that kind of thing. They are often not enforced very well or sometimes enforced at all. And so my question, Steve, is there potentially a role not just for immigration policy, but this in a sense for kind of local, standard kind of regular enforcement of these kind of occupancy rules?
Yeah, I'd say there's a real challenge here, because one of the analyses we do, which I didn't talk about, is we try to look at what fraction of people in overcrowded households or immigrant and native households in general, or I should say where immigrant and native workers are, and what kind of households are in which they're unrelated to, say, the household head, a very quick and easy way to look at that question. And the short answer is, the vast majority of these workers are related to the household head. There's this stereotype of immigrants living in housing that is that is crowded with a bunch of unrelated workers all trying to save money, sleeping on cots kind of thing. That is just not what the data show. The data show that the vast majority of immigrant households overall and the vast majority of even overcrowded households are generally all people who are related. Now, they might have more distant relatives, but in general, it is not the case that immigrants are living in a situation where they're all a lot of unrelated people. That happens. In fact, the highest percentage of any occupation we could find among immigrants, I recall, and I'm doing this from memory, was among meat and poultry processors and butchers. And I think it was like 16% of the workers were unrelated to the household head, which is not a perfect measure, but a pretty good indication that these are mostly families, maybe extended families, but mostly families. And so if you try to enforce the zoning and housing regulations, I don't think it would have that much effect. And the other concern I have with that approach is it might not be very sensitive to the unique situation of immigrants and how they live their lives and how they tend to have bigger families and so forth. So I'm not sure we could do all that much with that. And again, it must be emphasized, it's not a bunch of unrelated people as far as we could tell, but maybe that's an area for more analysis. But as far as we could tell, of unrelated people living together, that's not what's going on here. It's mostly related people. It's mostly families, and regulation can't deal with that anyway.
Yeah, good. Thank you. That's actually that's interesting. In other words, it's not an issue of 16 guys rotating on mattresses or anything like that. That does happen, but it's a relatively small part of this phenomenon. Steve, there's one of the things that happens is that we see a lot of COVID. There are hot spots in various outlier counties that don't really have a lot of immigration. In other words, where immigration clearly doesn't really seem to play much of a role in the spread of the virus in those places. Does that underline the fact that obviously this is a contributing aspect in some cases, but not really what's driving the issue?
Well, I would say this. When you look at some of those outlying counties, which we did with that county-by-county analysis, which was very brief, I should point out, they're often unusual places. Some outlying counties either have a prison, a long-term care facility of some kind, or a large jail or detention facility, not so far as I can tell, not associated with immigration, just in general, or some of these more rural outlying areas have some kind of facility, typically meat and poultry processing. And that does seem to be playing a role. There is another type of outlying county that also, and that is some, and you see this in the Dakotas, and you also see this in Alaska, Indian reservation. It is very common on Indian reservations, although they're typically, these big ones are rural or generally rural, there is also a high incidence of overcrowding. So I would say that there is also, I should point out, we do an analysis in the report looking by population density. And it is true that in rural areas, there is more overcrowding than in some more like suburban areas, not relative to densely populated areas. And that can reflect often the fact that farming and meat and poultry and fish processing often take place in rural areas. And these facilities, as I indicated, also warehouses even, have had a lot of outbreaks. And so that may help account for that. However, when we look at immigrants and natives who live in rural areas, the difference between the two groups remains extremely large. In other words, immigrants who live in rural areas, just like immigrants who live in urban areas, are dramatically more likely to live in overcrowded housing than are native-born workers who live in rural areas or urban areas. Now, having said all that, it is absolutely essential to again emphasize that it would definitely be a mistake to think that overcrowding or the immigration that contributes to it is even the most important reason for the spread of COVID-19. When we think about why the United States has done worse than many other industrialized countries, it's not at all clear that it's overcrowding. What is clear is that prior research and some newer research suggests overcrowding does play a role. The fact that it's not by any means the only factor doesn't mean that it's unimportant. And it looks like maybe it's important even in rural and urban areas and areas in between.
Go ahead, Peter. Sorry about that.
Okay. Well, I think an overall point that I would make that goes back to your original point, but it covers the waterfront in some ways, is that what I think is intriguing about this from a public policy and a political point of view is that the drivers of overcrowding among immigrants, whatever the specific and detailed causal components are, and I think Steve and his colleague have done a good job of laying out the alternatives and which ones seem to be the most critical. The fact is that it seems to me that immigrants are making choices that are that most of us would regard as positive choices, in the sense that they're very concerned about their relatives. They open their houses up to relatives, not just relatives, but that they have a strong sense of obligation and duty to their friends and relatives. And I think that has to be most obviously connected to this overcrowding dynamic. But like so many things in social policy, actions that are driven by positive motives may have negative outcomes, negative health outcomes in this case, which again it's important to underline that. So many of our discussions and debates about immigration and immigration policy either romanticizes immigrants and their motives and their culture, or it demonizes them. But the obvious reality for immigrants and for the rest of us is that often our own positive drives and emotions vis-a-vis our children, for example, might have obvious negative consequences for somebody else's children. If I take a spot in a very sought after school for my kids, well, I may be depriving somebody else whose kids might, in some other sense, deserve to be there more. But that is a difficult trade-off that we always encounter in social issues and social policy. And I think that's an interesting implication of what Steve is pointing to, that these are troubling outcomes, often, I think, driven by positive motives.
Yeah, and that kind of underlines the basic point, really, I think, of a lot of CIS's work, is that this isn't about immigrants as people, it's about immigration as a policy.
Yes.
Yeah, and one question, maybe for both of you, I mean, whoever wants to weigh in on this, one of the what we've seen from CBP, which is the agency that oversees the Border Patrol and what have you, is that they're suggesting that one of the things they've seen is illegal immigrants who have come across the border, and there still has been some flow, even though it's lower than it was, a year ago, are more likely to have the virus and then settle in immigrant communities in the United States and thus spread the virus that way, using that as kind of part of the rationale for the more extraordinary border control measures we've seen. Either one of you have any thoughts on that as to whether it's first of all, whether you have a sense whether it's true or not, but also, what are the possible implications of that? Either one of you wants to take that?
I'm defer to Steve in the first instance, and I'll ponder it.
I don't know about what is the incidence of COVID among people crossing. but it's an important question. It's certainly true that since immigrants, especially coming in or newly arriving or maybe even returning, are pretty likely to live with other immigrants, and since the analysis indicates that immigrants, workers anyway, live often in an overcrowded residential setting, that would mean that if someone coming in with it is going to be even more easily spread the disease, given the way these houses are laid out. So I guess that would be a definite concern. In other words, if someone's arriving in the United States and goes to an area where there's more overcrowding, then and they have the disease, then that probably is going to make the situation even worse. So that's a concern. That in a different way, keeping out people who have COVID-19 infections until at least their infection's over, is probably very helpful to immigrant communities because they're uniquely vulnerable to these diseases because of the housing settlement patterns.
Any thoughts on that, Peter?
Yep. Yeah. Again, from a somewhat maybe broader angle, and a point that I think is probably obvious, but like a lot of things in this in the immigration policy area, the obvious often gets excluded or overlooked, which is that one of the things I've been struck by, especially teaching as I do, especially undergraduates at Boston College, the rhetoric that one has heard, and it's not rhetoric in the pejorative sense. It's just sort of the articulated assumptions that people come out with that don't reflect much thought, but they're just assumed to be correct. That kind of rhetoric of always questioning borders, being skeptical of the need for control of borders, that we live in a borderless world, and that's the state of affairs, and that's even in fact desirable. Well, suddenly, in the last 6, 7, 8 months, that's clearly been brought up short and undermined. I haven't heard too many people complaining in Europe about the efforts of member countries of the European Union controlling their borders. It's obvious that they need to do that in the context of something like this pandemic. And in the same way, while there's been a lot of dispute about the Trump administration's handling of borders generally, I mean, the notion that that we need to monitor who comes into this country across our Mexican border is rather straightforward and obvious. Now, how it gets done and with what kinds of care and empathy, all those kinds of issues get drawn in, and I understand. But the basic logic of the need to control our borders, we've had a healthy wake-up call, and I think that's worth noting.
Good, thanks. Let me just take one more question because I want to respect everybody's time. But among the things that Steve and his co-author referred to, and then you underlined as well, Peter, was things like maybe increasing the minimum wage or increasing EITC or that sort of thing. In other words, government policy measures designed hopefully to increase the income, the earnings of people at the bottom, immigrants and natives. It wouldn't just be immigrants, obviously. But the question here with regard to immigration policy is that some significant portion, not all of it, but a significant portion of this phenomenon that we're talking about relates to illegal immigrants. And whether it's minimum wage or EITC, whatever, is going to be less relevant to them. It's not that, I mean, there are in fact illegal immigrants who file taxes, and minimum wages do have some effect on what illegal immigrants are paid, but it's more indirect. And so the question I would throw out is, are these kind of interventions by the government related to increasing earnings likely to be less effective than we might hope, precisely because a significant portion of the target population we would be trying to help are, in fact, illegal immigrants. Either one of you want to take that?
Well, I mean, I'll just say this. If you raise the minimum wage, there's no reason you wouldn't say it accounts for everyone, right? You could say that doesn't matter your legal status. It doesn't mean we're not going to enforce the law, but employers can't use your illegality as an excuse to pay you less. So that might be one of the more effective ways. You're right. If you give out payments, cash payments, if that were your option, then you're going to, obviously it's not likely to go to illegals, though in a Democratic administration and so forth it might. And in fact, there's evidence that the additional child tax credit is often received by illegals. I won't go into the details, but it has to do with the way the IRS interpreted the regulations. So, there's that as well. But your overall question of illegality, that does matter. But as I tried to indicate, I'll summarize quickly, about 2/3 of all the immigrant workers who live in overcrowded condition are legal immigrants. So anything that would apply to legal immigrants would have a very big effect. Legal immigrants are about 1/3 of all the workers in America who live in overcrowded housing. And if you focus just again on immigrants, then immigrants are about 2/3. So most immigrants who live in overcrowded are legal, and that makes sense. Legal immigrants are much more numerous than illegal immigrants. So yes, it's true that illegal immigrants might be left out if you did income transfers, but a minimum wage should benefit them as well. I should point out that when you drill down into the data, at least that we had, and assuming that we were successfully, and all we did was base our analysis on the work of others, if we successfully identified the illegal immigrants, it does not look like they make dramatically less than the native-born working at the same job, which isn't too surprising because they're doing the same work. They probably make about the same wages. So in that sense, it doesn't look like immigrants, even illegal immigrants, work for dramatically less. The reason illegal immigrants make a lot less on average overall is that they're much less skilled. They may have 11 years of schooling on average. A large fraction, as far as we can tell, report that they don't speak English well. And these are big hindrance in the U.S. labor market. Low levels of education, moderate levels of English language knowledge, and so forth. So maybe that's a long answer to a short question. But the bottom line is that things like minimum wage would probably help the illegal immigrants if we're going to be letting them to stay. And I guess my final point is we have to make a decision about that question. If policy is to let illegal immigrants stay, then we need to legalize them and try to make sure that they are as protected in the labor market as they should be. If the policy is to try to enforce the law and encourage as many to go home as possible, to help American workers, to help legal immigrants, put upward pressure on wages, then that's the other policy. In some ways, whenever you bring up illegal immigration and what to do about illegal immigrants here, it really harkens back to the underlying question, what do we want to do with illegal immigration? Do we want to actually enforce the law and try to reduce the size of illegal immigration, or do we want to just tolerate it and manage its consequences, and to that end, or maybe even legalize folks? That's obviously another big option. And I think that's really the question you're asking, what to do about illegal immigration. It's a reminder, though, that tolerating illegal immigration and not resolving that problem has a cascading series of consequences on our society, and this is just one. It makes it harder to deal with a problem like overcrowding.
Any thoughts either on that or just sort of general last thoughts, Peter, because we're going to wrap it up here?
Yeah, well, on the topic that Steve was just addressing himself to, in response to your question, I guess what this raises for me is something I've argued elsewhere, which is that if we, I might, other things being equal, in the context of this conversation, I might be inclined to argue for a minimum wage approach as opposed to a earned income tax approach, for precisely because it would serve to benefit illegal immigrants more than an earned income tax credit would. And when I say that, what I mean to underline is that I've argued that I think we need to own up to the fact that illegal immigrants are here, particularly under current circumstances where the influx of undocumented immigrants is greatly curtailed, if not come close to stopping. You gentlemen could elaborate on that better than I. But I think, particularly under these circumstances, we have responsibilities to people who have been here, especially people who have been here for many years. They're here illegally in part because we've let them come here. We've encouraged them to come here as a political community. We've done that, and I think we need to own up to those responsibilities. But we need to own up to them in a way that doesn't put in place incentives for more undocumented immigrants to come here. That's, as you know better than I, a difficult tightrope to walk. But we need to try, and I think that is an important element of any immigration reform moving ahead. Not to vilify or penalize most of, if any, of the undocumented who are here, but at the same time owning up to what a catastrophe this has been politically and otherwise for us as a nation and for the undocumented themselves, and moving forward to make sure that we don't allow this to continue. And on that note, I'll stop.
Thank you, Peter. It's Peter Scarry, professor of political science at Boston College, commenting on the report we've been discussing today, led by the co-author of the report, Stephen Camerata, director of research, Center for Immigration Studies. The report itself is online at cis.org. We're also on Facebook, and on Twitter we are at cis_org. We appreciate everyone's attention and questions and look forward to having another one of these events in the future. Thanks for joining us.